sibling, the big sister, big brother, whatever that may be. And as that identity, I should be doing more than my younger siblings. I should be further ahead. I should be more social. I should be leading the charge in some aspect.
How is this affecting everyone, whether it's SM or it's the other child that has their own challenges and needs?
Welcome back to another episode of the Unspoken Words podcast, a Selective Mutism podcast hosted by Dr. Elisa Chapman-Blum and the Smart Center, powered by New Edition Media. This episode features a deep dive discussion between Dr. E and Smart Center lead clinician and school consultant Jennifer Brittingham on the popular topic of sibling dynamics. In the episode, Dr. E and Jen discuss the role siblings play in family dynamics, building confidence and independence in your children, managing jealousy amongst siblings, and more. Before we get started, remember, if you have any questions on anything covered in today's episode, please head to selectivemutismcenter.org/ask Dr. E and enter your questions using the form. We read all of your submissions and do our best to answer them on podcast episodes, blog posts, and on social media. And speaking of social media, for the best of this episode and every episode of Unspoken Words, make sure to follow the podcast on Instagram and on YouTube. We are at Unspoken Words _podcast on Instagram and Unspoken Words Podcast by Dr. E on YouTube. So, without further ado, please enjoy the latest episode of the Unspoken Words podcast.
Hey everyone, before we get started, did you know that the Smart Center treats more than selective mutism? I'm Dr. Jenna Blum, lead clinician at the Smart Center and head of our growing General Mental Health Counseling and Assessments Department, otherwise known as CNA. CNA is a mental health agency that provides psychological assessments and counseling services for a wide range of mental health issues. We treat children, teens, and adults. Whether you're looking to get you or your child tested for ADHD, autism, or additional learning difficulties, or more, looking to move forward with counseling services to help with your depression, or looking to treat your generalized anxiety disorder, our team is ready to stand by your side. So please find counseling and assessments at the Smart Center in this episode's description, or head to counselingassessments.org and book your free complimentary call with our team today. Okay, enjoy the episode.
Hello, listeners. Welcome to another episode of Unspoken Words. And I can't start a podcast without saying I am so excited. I love the topics we talk about. And today I have the honor to be with Jennifer Brittingham. Hello there.
Hi, Dr. E. I'm glad to be here too.
It gives me an excuse to see you.
It does, yes.
So
yes.
It's nice. We're often passing in the hallways at that and coming and going. And so to be able to do a podcast with you and have you share all your years of wisdom and experience with our listeners is just something that I know I'm grateful for. So thank you.
You're welcome. I'm glad to be here. It's good to see you.
So today is going to be a very interesting topic, and we're going to talk about sibling.
That's a good one.
It's a good one. So if you had to think about siblings and the kind of the topic of siblings, what comes to your mind?
Okay, a few topics come to mind, but one is that when families tend to come to us with more than one child at home, there's dynamics.
Yes.
And so how to work with all the different dynamics. Yeah, I think sometimes parents aren't quite sure how to involve their other children, or maybe, what's the word? Uninvolve them a little bit when they're too involved.
Yeah.
Yeah.
No, I love that you said dynamics, because what came to my mind is that there are trends of similarities in our families, and we're going to share that today, but that there's so much uniqueness to the sibling dynamic and the family dynamics that there's never two that are exactly the same. So it's really important to really think about how the child with SM is impacting the other children, how the other children are impacting the child with SM. What if you have multiple children in the family with SM? Which, just an FYI for our listeners, it tends to be more of the genetic, socially anxious kids that is the case with, unless they're identical twins that have the same sort of challenge developmentally or learning or something. But in my experience, I don't know about yours, it's usually that kind of family history of the social anxiety component where you have multiple members that might be selectively mute. Do you find that as well?
Yes. And on the other hand, if there are more of those Ys of SM,
Yep.
right, when we get into that part of it, of what's sort of exacerbating the SM, if we don't see a lot of those genetic pieces from the SM perspective, I usually lean towards what are the other whys that are happening underneath that we might be seeing more behaviors of this child, but not necessarily with the others.
Yeah, no, excellent point. So this is why I wanted you on this podcast, because you have so much, we've been together now for 20, almost 25 years, 24 years.
20
years.
I think this January is 20 years.
So it's our anniversary?
It will be.
Oh my God, it felt like forever, more than that, but in a good way.
Don't give away what you're getting for me. I like a surprise.
Oh, okay. I'm going to need the help of the staff to come up with something really special. 20 years?
20 years. 2 decades.
Oh my goodness. Wow, that's insane. But the reason that's so wonderful is that the amount of experience that you have with me together, talking together, sharing families, patients together, and just the amount of experience we both have with SM between your 20 and my 30. You're talking, and I'm like 30 plus being a physician, right? So you're talking like 55 years of experience, 50 in SM, basically, the SM world. That's 50 years of experience. That's a lot of experience. So we have a lot to kind of share with our families today. So let's talk about some of the effects with the sibling dynamic. How about the stress in the family? The stress of parents raising a child with having some difficulties, whether it's SM or something else, or just the stress alone, and how that can affect the sibling dynamic. One, parents projecting stress and having to manage their own, that's for sure. But also the stress on the other sibling, the other children in the family that don't have SM from having a child that has these needs. I'm trying to be careful with the word special needs because we have a lot of listeners that are new to this, but also like that term is so vague. Mm-hmm. So I would say some challenges and some needs. And if you think about it, every child has challenges and needs. It's just what those are, right? But from a social communication anxiety standpoint, let's just call it anxiety, the stress involved and how that could be affecting siblings. Would you like to share like what you see in some of your families?
Yeah. And I will say, you're bringing up family stress. The family system is that. It's a system. And whether your child has selective mutism, anxiety, or whatever the unique needs are, every family has stress. Just having multiple children brings stress to a family.
Being married is stressful.
Absolutely.
Being single is stressful. Jobs are stressful.
Yes.
Life is stressful.
Yes. So then when you bring in a child who may have some difficulties or have unique needs, whatever that may look like, yes, it sort of exacerbates that stress in the household. What I see often in a lot of my younger clients is that when there is a child with selective mutism in the household, there's a lot of attention that goes to that child. And it might be attention of we're observing a lot, watching what this child is doing, what they're not doing, a lot of parent discussion. And with that comes parent worry. Maybe parents are on the same page in terms of what to do next. And that creates stress in the household. So there's that parent dynamic piece. And then from the sibling perspective, if a child is getting a lot of attention over their SM, their difficulties, or just more attention to caring for this child, doing for this child, I find that siblings can become jealous, act out, or maybe there's resentments that come about depending on the age.
Don't go too far into this,
I won't.
that's a whole topic in itself. But you talked about the child with SM and then the stress that could cause when the attention is on that child. We have other families where the child with SM is almost like when we see them for a consult, let's say, and we're directing families to parenting goals and changing behaviors, the psychoeducation, needing to educate others, implementing the goals, the games, whatever it might be, that will say, I have 3 other children, 2 of them, one's on the spectrum, another one has learning challenges. My husband lost his job. Like there's so much other stuff happening. And with those other children that have other stressors that are causing their attention as a parent, I've seen it where the child with SM is the one getting neglected and their needs are not getting met. So it works on both sides.
Absolutely.
And I think the key is to really look, that statement, look, listen, and learn, like really look within the family. How is this affecting everyone, whether it's SM or it's the other child that has their own challenges and needs that are beyond typical childhood? How is that affecting the child with SM? So it's not an easy answer. Right. And for many families, they're so engrossed in this that they can't see the forest through the trees or the trees through the forest. What is the statement there, Jen?
see the trees through the forest?
Yeah, exactly. Like they can't see it because they're so enmeshed. So it is about working with your treatment provider to really help you pull it out. And I know that's what a lot of our families so appreciate is we're able to see it and say, hey, this is what I'm seeing. Here's some things you could do. So I think that increase in stress is really important. And like you said, how it manifests itself. And that kind of leads me into how some families will have different siblings and different families will take on different roles. So I'm thinking of some of my older siblings, a child with a younger child with SM, how some will take on a caretaker role. They'll be the person that protects, that caretakes. Caretaking and protecting are similar, but they can be a little bit different.
Sure.
I'm thinking of my 13-year-old sister, the 9-year-old sister, and the child that's 5 with SM, and they're little mommies.
Yes.
Right?
Yeah, I was going to say that I had a client who the child with SM was 5, sister was 11.
Yeah.
And oftentimes in session, it felt like we were having parent discussion with 3 parents. It was mom, dad, and their 11-year-old.
Yeah.
And all of them were very much all doing, and it felt uneven. Right, that the child role wasn't the child role. She was really coming into it, that caretaker role, and that can be good and bad.
Right, absolutely.
And
Let's dive into this one.
So you mentioned something that I think is important, which is you have, as we were discussing examples, and you said on one hand you could have a child with SM kind of neglected. And then the other part is they're getting all the attention. And in my notes, I sort of wrote down like a seesaw because you do have different presentations in the household, different dynamics. And what I love about SCAT and this world is that there's no one way to treat. There's no one specific strategy. It really is adapted to what is the family's needs, not just the child. That's the whole child approach is the family. And so I love that piece. I just want to point that out, that no matter what a family is going through, it's a family's unique needs, and there are strategies to better understand that family. And that's important. The piece of what we're sharing about is when you have a child who has SM and the older child is taking over, let's say, who wants to parent, there's some good and bad there depending on, for me, the older child's personality. Because sometimes we can have an older one who's taking over, and maybe they're just doing too much. They're doing all the talking. Right? My sister doesn't talk. She won't answer. I know the answer for her already and gives all of it. Because maybe that child is a really outgoing child already. They're very talkative. They have no challenges in communication. And the more that they can fill up the space for their sibling's not as uncomfortable. And so we might say intrinsically that child's being super helpful. They're being empathetic to their sibling. They want to help them. They don't want to see them, in stress. But the other part of that is they might be doing too much. And we definitely want to make sure that we're using them in the right capacity, the right role, which is helper, but don't overdo.
No, I think you're bringing up, great points. And for some of these caretakers, like, as we get some of these younger kids, and many of them have the social anxiety, the sensitivity. Some have some separation issues. We will use these siblings in the treatment. They'll come in, they'll be either a verbal intermediary, they'll just be a helper in the session. And that makes our child patient with SM feel safe. And I'm thinking about so many cases where they just love it. I'm thinking back that I've been doing this for so many years that we have one coming to our upcoming camp that is a sibling of a child I treated, and she would come in session. And she would do her bridge when my patient did her bridge. And she learned the bridge and she learned feelings. And sometimes she'd interrupt me and say, well, how do you feel about that? And it was like, whoa, she's going to be a treatment provider.
Yeah.
And needless to say, the mom reached out. I've been in touch with this mom ongoing over the years because a lot of families always keep in touch with us. It's like, hey, my daughter Sarah would love to be part of the camp and help out. I'm like, absolutely. And there's been a number of families like that. And it's not always just girls.
Sure.
I have another family right now where the child is about 5. Her brother's like 8. He comes in session. He brings some of her stuff from home. She is comfortable with him. I've worked with parents to kind of make sure he has his own needs, just like these other kids. Like, we have to see, like, how much are they giving of themselves? Is it just in session? Is it part of the process, or are they losing themselves in this? So as much as we love the caretakers and the ones that are the protectors and the helpers, it's also about making sure their own needs are met as an individual and not just the caretaker or the another mother or father figure to the child with SM, because We don't want all that. We don't want them to lose their uniqueness we want them to have their own identity. And so for some of these families, we've had to say, hey, look, it's wonderful that Jared is just so helpful. And he's like super brother, right? And he feels so proud and so good. And he's helping her play her games and color it in and make the bridge and point things out. But what about his uniqueness? Well, maybe that's part of his uniqueness. That's part of who he is. He loves to help. The teachers say the same thing. In school, he's the helper. He loves to help other kids with assignments. That's fine. But I just want to make sure that there isn't a compromise on their needs. What are you thinking? Because I see you have a look on your face. Not that our listeners can see that, but I can see it.
But I agree, because the same thing that you see of this child, which is, it is a unique gifting. If you're that empathetic, caring person, you want to help, we want to utilize that. To tell a sibling, no help from you, that's hurtful, because they really want to be there for their sibling. So in session, I often will say to parents, and this does, not that we're talking about school, but it does parallel over to school, because some of these very same kids are the helpers in class, like you said. But these are the same children who oftentimes to our SM child are the classmates that are overdoing, answering for, and teachers may come back and say, the kids just treat this child like a doll or a baby, right? So we can see those parallels at home and in the real world. So one of the things I usually do in session is I'll say, we want to utilize them. So what are some key ways we can, and why not bring them into session and teach them some of the strategies? Yeah. If they're already sort of in this role, this dynamic that they're doing some of the same things parents are doing, what are we doing in our sessions? We're educating parents on the best way to create opportunities for the child, not to speak for them all the time, not to do for them. So we can teach our kids age appropriately a couple of things they can do. So for instance, if I have a client who's coming in with their sibling, that sibling is always doing all the answering and everything in session, I might say things like, I might guide it and say, well, give me your answer first, and now let's check in on your sister's answer. And they might say, but I know her favorite color is pink. And I might pause and say, maybe she's a different color today. Let's ask. And I might say, what do you think is your favorite color? Pink, or is it purple today? Tell Max. So I'm modeling those strategies of how to be a verbal intermediary and pausing, checking in instead of answering for. And those are strategies that we can teach our families as a whole.
And sometimes when we think about the bridge and the stages, I love that you're modeling. And sometimes one of the things that happens is when their sibling is there, they feel more comfortable, their anxiety goes down. And when you say, what is your favorite color today? They may just answer.
Sure.
So we never want to jump in, as we always say. So sometimes you have to tell the child, the sibling there, hey, give your sister or brother a chance.
Yeah. Because
they are so used to jumping in. And one of the things we train parents and teachers is give them 5 to 10 seconds to respond. If they don't, re-ask it as a choice, Sometimes we ask as a choice first because we know that we're hopefully going to get the answer quicker. But as we're moving to more open-ended, thought-provoking questions, they may have a more challenging time responding, especially those that may have one of the whys of difficulty processing, and it takes them longer because there's a lot of kids we ask questions to. And what I've seen this in session with siblings is when I tell the older sibling or even the younger sibling, because we're going to get into that, I have some questions from listeners, like a question, the older sibling jumps in and I say, hey, let's just wait. Look at, you see they have either a smart device or a watch. I'll go, look at your watch and just or count to yourself quietly 10 seconds.
Yeah.
And it's amazing how many times when we give that wait time, the kids answer. But they're so used to their sibling answering. And how often do we ask a question? And I'm sure this happens with parents where they're trying to involve, because we teach the SM triangle, right, of how to involve the child in the social communication situation by bringing them in and not answering for them or telling them what to say right away if they're not there. But we ask them to kind of wait it out, and they just kind of answer without even having to do a verbal intermediary.
Yeah. And you said something really great, which is
Thanks, Jen.
You're welcome.
I can't wait to hear what it was.
You often will say, give it a 3 to 5 second wait time before a parent jumps in. But we have to teach our siblings or classmates, whoever that may be, friends, to do the same. And our adults sometimes can do that wait time, and sometimes our younger ones don't always count to 5. But we can be direct and give some language with that. I like to use the power of the pause. So I will bring that language up of let's take a pause. And so we'll create a pause and count, or I'll say, let's take a beat. And so finding some quick language to remind your sibling when they are ready to do that, and you can sense that your child wants to jump in for their SM sibling, is to have some quick language that represents that time period that will help them just
I
to
like
pause.
the let's take a pause, and maybe let's take a pause. 1, 2, 3. The reason I sometimes say 5 to 10 is because it turns out it's quicker.
Sure.
And also I teach parents, teach teachers, I teach siblings older, especially if they're older, like to kind of not stare the kid down, because the more that we stare their sibling, like the child with SM down, the more expectation they feel, the more anxiety they feel, the longer it takes.
Sure.
So often, like with us, we might be writing something or coloring something as we're asking questions or turning, you see what I mean? So it's all these like little subtle things that we're actually teaching the sibling what to do and how to do it. You know what I mean? Hey listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode. So what about the older child? Like a question came in from a listener. Dr. Ian Jen, I have an older child with selective mutism. She's 13 years old. We have a younger child who's 8 and a younger child that's 4. We noticed that the 13-year-old is feeling you could see that she's not feeling as comfortable. She's almost feeling a little embarrassed because her younger siblings are chatterboxes. How do we deal with that? What do? We can't tell them to stop talking, but at the same time, it's affecting our 13-year-old self-confidence and self-esteem that their younger siblings, the babies, the ones that, you know what I mean, are the more chatty and social. So this affects especially a 13-year-old that's very, more aware now, probably as they're getting older, especially with peers, as that's affecting them, like the puberty and social relationships. Now there's younger siblings are social, they're getting older and comfortable verbally. How do you deal with this? What do we do?
Well, I think that's one is that happens often with some of our kids with younger siblings. And that age range, like you said, is a really critical time for our kids. They really do start to compare themselves because you're feeling older. That middle school time I think most listeners who have middle schoolers would say, yes, it's a major change for their kids. And they do start to socially compare themselves. And there is this idea of I am the big sibling, the big sister, big brother, whatever that may be. And as that identity, I should be doing more than my younger siblings. I should be further ahead. I should be more social. I should be leading the charge in some aspect. Now, that's not every child's experience, but there can be that big sister, big brother dynamic. And so that's real. And I think it's good to identify that even though you may be older, all kids have a need. Right. And we have to address the needs. So although their younger children may be more social, or it's easier for them to come into communication, I think having some good language to recognize that this is something that is challenging for you and not as challenging for them is good, just to recognize that everyone has a need. Just like those younger children may have some other challenges they have that might come very easy for the older one. I think that's important. The other part too is I always ask from a family dynamic standpoint. I know there's a number of answers to these questions, but one of the things that come to my mind with this dynamic is how often are we going out as a family unit where the 13-year-old does have to compete with the talkativeness of their younger siblings? It's always important for me that we do family dynamics together. I think it's good to go out to dinner as a family, to practice goals in restaurants, practice in stores. But I also think it's really important to give time for that sibling alone with parent practicing goals without the competition. So that's one question I would have is how often is this parent going out on their own to work on those skills and strategies where they don't have the immediate comparison of their younger siblings?
No, it's interesting when you've worked with someone long enough. I wrote all these things down and you kind of said them all. So I'm just laughing. I'm very open as you are with your patients, right? Your clients. I call them patients, you call them clients, because the whole therapist doctor thing, right?
Yes.
But I'm very open. I talk about their frustration they may have, and maybe they write like a letter, a make pretend letter, or what would they want to say, and having them write it, but really talking to them about this challenge and explaining that everyone has something that's difficult for them, but also everyone has something that they're strong with and they're good at. And really helping that 13-year-old or that child realize the things they can do, the things they are good at. Like, for example, I have a 14-year-old who is amazing at math. She's a math whiz. So we're giving her tons of big shot roles. One, she's helping her younger siblings with their math homework. She's a math tutor in school for a couple of the younger kids. And even for someone in their class, she helped them during lunch. And that's a confidence builder. So it's really important for all of our kids, but I could see this coming into play just so much more to make this point, is we have to help our children build their confidence and their independence, because this does affect confidence, anxiety, right? Having anxiety, not having the coping skills yet until they're getting through treatment. But they do compare, and the older they get, the more they compare, the more they realize, whoa, talking, that's easy for those people. Why is talking so hard for me? Why is it hard for me? Why do I feel so uncomfortable in these situations? And it affects their confidence, but also their independence, because whether it's their younger sibling doing for them, or their older sibling, or their parents, or their teachers, or their classmates, I find that a lot of people do. They do for them because they don't talk as much. They aren't as communicative. So they're speaking for them. So they're not as independent. They're doing for them. They're protecting them, parents in general, right? And so we have to build independence. And these are separate podcasts. And, I have handouts on this and stuff about how to help build independence in children, because they have to be independent. They've got to realize that they can do things on their own and build their confidence, because that in itself will lower anxiety, which it keeps feeding each other, right? So definitely helping them be a helper for their younger siblings. Maybe they babysit, giving them these big shot roles. Also, we talked about the independence and really strengthening their own skills and having these conversations. And also, like what you said, like also separating out, right? Maybe you go out, you don't always take the younger kids wherever you go, having a mommy-daughter day or daddy son or daughter day, whatever it might be, mommy Sunday. I mean, we can go all over the place with this, right? And really kind of just having that alone time too, that they're not always in a situation to compare themselves to the younger siblings. These are just some tidbits to share with our listeners. Of course, every family is different.
And you brought up something about the independence, and I will say, and some families over the years, I feel, when you have more than one sibling, you have more than one child, depending on the age differences, sometimes we can lump our kids into like the same rules. Like what's good for one is good for everyone, so to speak. What I mean by that is like, I might have 3 different age children, a 5, a 7, and a 9. And all of a sudden, all of them are going to bed every night the same time.
Right.
Everyone gets up the same time.
Right.
Sort of the rules apply for all of them. And we tend to make the rules sometimes for the youngest child, and everyone sort of succumbs at times to that. And often I'll say, if your 9-year-old is the one with SM and they're older and they're having to go to bed or do the same type of chores or activities at home that the 6-year-old's doing, and we have a lot of comparison between siblings, one of the first things I'll say is, what makes them different as an older sibling so they can look independent? They are different. They're a different age. With age comes, new activities that you can do, new privileges. And so that's another way of changing those dynamics in your household to start to separate out. So that's one thing.
I love that. I love that. I mean, I had 4 kids in 3.5 years, right? It was really easy to lump them together. And for any of my children listening to this, because I know that's going to happen, we really did try to give the older child more responsibilities in different areas and kind of more age-appropriate chores. So if they were doing chores or jobs at home, they had more age-appropriate. So, maybe somebody was, I don't know, doing the laundry, the other was folding the laundry. We also did the same sorts of things with where they sat in the car, because you do want them to have that role because that, especially in a situation where if the older child has SM, and the younger children are the chatterbox social beings, and it's not the same with the child with SM-13. This is another way, like you were saying, to kind of give them these kind of privileges, these roles. And, it really does help. And so I love that. I love that information, because you're right. I think a lot of our listeners can take that and think, wow, you know what? I've been treating my 11-year-old the same way I treat the 4-year-old, because I don't want to treat them different and make them feel like, one is different than the other, but they are.
Yeah,
They are.
It might be convenient for the family sometimes to operate that way. More than one child, you know best that it could be easier to do that, but it is important. And the other part too, I'll just mention as we move on to our other topics, is that when you do have family dynamics, oftentimes I've heard of a parent say, sometimes I get very frustrated that my child is not doing things. You know, they're 13 now and I want them to do X, Y, and Z. If your 5-year-old sister can do it, you can do it.
Oh, geez.
And I will say that's when I do bring up that component of, if you want your child to sort of act, whatever the developmental age is, we do have to separate them out and give them this has to be independent, because if you're lumping them together, but yet at certain times you want them to act older, what opportunities are you giving them to work in that area?
No, I think that's, that's great. So a question came in from a listener, Dr. E, Jen, we have a child with SM and then a younger child that doesn't have SM. And we noticed that the younger child is acting out a lot. It seems that he gets so easily frustrated, especially when we're trying to do our different games with our older child and the different goals. And I'm trying to really put effort into it. We notice the younger child is really acting out. What advice do you have about that? And why is that happening?
So this is the jealousy piece,
this
right?
is the resentment. This is like, are we just putting all our efforts on the child with SM? Almost like, not that, like really everything, but
sure.
Are we neglecting the younger guy in this situation? Is there other reasons he's acting out? Does he have his own challenges, like emotional dysregulate, whatever it might be? I mean, there could be a million reasons, right?
Sure.
But let's just say there's a relationship, because the mom clearly, or the dad who wrote this in clearly said, it seems that when we're doing our games and goals, our child's getting like angry, upset, and almost like it even mentioned being destructive at times.
Sure. Well, if we're looking at this from let's just take it from that jealousy standpoint, we have a younger child. And one, do they understand that, hey, your older sibling is going through something and they need our attention? Sometimes our children don't always understand the why behind why we're doing things to the level that we do as an adult. So addressing things in an age appropriate way is good. But the other part is, we can't expect our youngest children to give us all the grace and space to do these things, that sometimes we might just have to implement some goals for them too. So one is that if we're seeing a lot of jealousy that's coming up and we've had some conversation of, your brother needs this and so we're helping, that might be well and good, but then it's talk about it, but then do something about it. And so the doing part might mean, what does your younger child need to do? So are we looking at giving a younger child some sense of responsibility when we're out working on goals, that they have something they can do to be part of it? Or do we take it to the degree of, if the older one is sort of charting what they're working on, do we give both kids a chart and they just work on something separate? But we can talk to our child. And sometimes our parents are like, but we've had conversations. We tell them that they need this. They're struggling with this. And I usually will say, yes, talk about it, but then let's do something with it. So what's the doing part? And that might mean giving a chart. So what could a chart look like? If your older one is tracking all the times they've paid for something in a store, or they're going out working on whatever the strategy is that is specific for that child. How about for the younger one, that when they're out, they're going to be the one to put things in the cart and carry their own little cart with them, and they're going to have their own thing that they work on, so that they feel that they're being highlighted, lifted up, attention is being spent on them and the good stuff that they're doing too? Or is it chores at home, or putting their toys away? What are we charting with them as well? And
we know that a large percentage of individuals with selective mutism have that social anxiety, and that we've done family history studies, and a very large percentage have that genetic component. So now you're almost getting a 2-for-1.
Sure.
Why not if this child is a timid child, a highly sensitive timid child, for example, they'll benefit from a lot of our goals and games and things, to have their own charts. I have so many different goal charts that I use with my child with SM, but their siblings have their own chart. Mm-hmm. We may make it a different color and things like that, but they're working on their goals too.
Yeah.
If that is a good type of thing to implement involving that child, like you said, now you could reverse it where the older child is acting out. So it's an older sibling with a younger child with SM. Mm-hmm. So instead of so now it's reversed, right? It's the same concepts. Why? What I tend to see in some of the older kids, if they are feeling the neglect a bit, or jealousy, jealousy is they seem to be a little more on the sadder side, not as acting out, where the younger folks, the younger kids, will act out more behavioral dysregulation. I just see it because it's little kids will act out when they can't get their needs met. Whereas older kids that don't get their needs met, they may act out, but I see more sadness and depression. So before you're jumping in treating meds for your older kid and saying she's, or he is depressed, let's figure out what might be causing some of those challenges. And if there is a role of maybe I'm not able, I've noticed like I haven't been, look, I work with a family now that has 3 special needs children, 3. Well, there was a child with selective mutism, another child with learning challenges, and the other one that has autism, which is challenging in itself. And this mother is, and this whole family, she has a partner, they're pulling their hair out. They don't know what's up and down. They're so stressed themselves. So you're seeing these acting out and these other things happening. So you got to like look at that too. Mm-hmm. But if you were to kind of say, let's piece things out just for our listeners' piece, that there is a neglectful, they're not on purpose. They're just so busy, right? Mm-hmm. They're working. They're trying to juggle their family, all the responsibilities of life. It's crazy. They're noticing their older child is becoming more aloof, Depending on the age, it may not be uncommon, as you said, with middle mm-hmm. schoolers, right? It's a time they start to go within themselves more and they're really thinking of things. We got to deal with that. We have to deal with that. And it may mean that, especially if you have a partner, and some families don't, there's single parents raising children, but maybe they have extended family members that can help, family friends that can help, where they're now kind of giving time to that other child, maybe doing different things. Mom takes one child out, dad takes another child out, one goes to grandma's, one goes to Aunt Sally's. You see what I mean? One goes to a play date. Like, you got to make sure. It's hard. The more kids you have, the harder it is.
Sure. Well, there's more dynamics, more needs, lots of unique needs. And I agree with you. Having a family system or having a peer group, a community that will help you. And that could be, like you said, whether
it takes a village, a community village.
Spouse, partner, neighbor, cousin, uncle, it doesn't matter. We need to have more people on board to give us a hand. And that can be also really challenging for parents in the busyness of life, is to find who those people are and involve them.
Yeah, no, for sure. We got another question from a listener. Dr. E and Jen, I have a 7-year-old with S. We're about to start treatment. So they're fresh and new, Jen. There's so much to do. Our daughter is mute in public settings and at school. We've noticed our 5-year-old becomes mute also. Is it possible that our younger child has selective mutism also? I mean,
it's a good question.
It's a great question. Yeah. Well, number one, we can't answer that by just this, right?
Correct.
But we can ask some questions.
Yeah. Well, I mean, right away, the quick answer is, could this be selective mutism? The answer is yes, it could be.
Yeah.
But it also could not be.
Right,
So
exactly.
we want to make sure we're exploring that. A few things that come to mind too, especially because they're new to treatment. Then I have questions about what have they been doing already that's been working, because that age difference, a few things. One, if the parents haven't been giving a lot of opportunities. So what I mean by that is, I'm going to go backwards for a minute. Think about post-COVID, the first year after COVID. A lot of parents weren't going out to stores, taking their kids to restaurants. So if we've gotten into a habit of not being out and about, and we haven't had a lot of opportunities, how is our child how do we even to assess or observe what they can do if we haven't had a lot of opportunities? So sometimes I look and say, what are your opportunities to bring the 7-year-old into communication? One, that's one thing. And the other part is, if we're not having a lot of opportunities, we should try that. We should try, because SM and the work around SM is not a individual treatment. It is a family system. It's a family treatment. It's about changing the culture of your family. So one, if we are giving opportunities to our 7-year-old and we start to pick those up a little bit more and see how they're functioning, do we still see that similarity with opportunities? Because our 5-year-old may be able to do more if we're providing opportunities for them to do more. The other hand, if that 5-year-old is not, that's where I look and say, are we mimicking what my 7-year-old? And that's why the opportunities are needed to rule out, is it a mimic or is there truly a challenge?
No, I think that's great. I feel like I could have written this question into somebody when I was going through this with my daughter, because my daughter, Sophie, was older, 2 years older than, well, a year and a half older than Jenna. Everyone knows Jenna now and Sophie, but Jenna would mimic her. So in other words, when we would go to swimming lessons or we would go to gymnastics, Jenna just zipped it up. But guess what? When Jenna was away from Sophie in like a social situation, or not away from Sophie, but away from like a social situation on her own, like in school, and Sophie wasn't independent, wasn't with her, Jenna was a chatterbox. And, by the way, she still is.
Yes.
And so is Sophie now. But back then, Sophie was not. And she really struggled in social situations. Obviously, that's the impetus to my work. But Jenna would just shut down and she'd just follow her sibling and her older sister around and do whatever Sophie did. So I know there's a lot of listeners out there with the same dynamics as that I experienced. So when this family wrote this question, I'm like, I could have been me.
Yeah.
But the answer, the way a quick answer, like you were sharing, is what is she like when she's not with her sister? Or what is that child like when they're not with their sibling? Are they SM? Do they go to school? Are they mute in school? Now, I do have some that are. But it doesn't mean it's the same level of severity, let's say.
It doesn't present the same.
It doesn't present the same. But since SM is a social communication anxiety disorder, whether they're mute in school or not, if there's areas they're struggling socially, communicatively, they can always benefit, right, from support. And those are the kids that, one, I do try to separate a little bit, have them have separate play dates, take them out separate, so that child can see themselves in a role where they're not necessarily with their sister mimicking, and they can be their own person. And if they have a friend, have that friend join with them. So like if this were Jenna, I would have said, hey, Jenna and Sarah, maybe they'll do gymnastics together. And for this season, maybe we'll separate them out. And then you've got the parent go, but I can't, I'm only one person and I need to do them together. I'm just saying to you, if it is a mimicking situation, it's really hard to rationalize with a very young child. In fact, if you talk too much about it with them, you are
over identity of it.
Yeah, you actually are reinforcing that connection, and they may do it even more. And I can think of like 3 or 4 families I'm working with right now where the child separated from their sibling is not SM.
Sure.
And then I can think of multiple cases where they have that predisposition. In fact, I think at our upcoming camp, we have a few siblings coming, one younger, one older, but they both manifest.
Yeah.
And
I was going to say, I think when families come in for session and they're worried about, I'm here for this child, but I may have another one who has it. I like that because you said it earlier, it's like a 2 for 1. If you're going to do strategies for one child, let's try it for the other.
Assuming they're similar.
If they're
right,
similar, yes. Right? And the other part is, separating them out and giving them those opportunities gives you a chance to see their personalities and giving a chance to sort of like pump their own muscles in their own areas.
And I know what there are a few listeners saying, wait, I have twins. Oh, I have twins. They have the same friends. Number one, I raised twins, and I can tell you in general, they didn't have SM, but I'm a big believer that relatively early in schooling, they should be separated.
Have their own identity.
They need to, because too often they become almost like one.
Absolutely.
Especially if they have that predisposition to be that, and one will lean on another, and then it affects. So I'm a big proponent of doing that in a way that makes them feel secure and safe in a transitional way. We don't just throw them into separate situations. But I think that's important. So what we're talking about with whether it's a sibling that's a twin or not a twin, it's similar.
Yes.
But I will say twins with SM, we've had numerous twins throughout the years. It can be harder because they have been raised since the time they came out of their womb as basically like they speak the same language sometimes. They're very connected, especially the identical ones.
There are those twin dynamics.
The twin dynamics. And having fraternal twins, they also had their own language. So that twin connection is really strong.
Yeah. I mean, we've seen this in numerous community camps.
Yeah.
We've had twins come, and there can be a slight difference where when one twin is sort of feeling a little more comfortable and ready to make steps and strategies, how if the other one isn't, that twin sometimes may withhold or be hesitant to make progress without their twin
training or anything.
Sure.
It can go, it's similar, it's very similar. One's making progress, the other's not, the other that's not pulls them back down, or the one that is feels a little guilty, goes back. I mean, it works, or it could be motivating. Oh, my older sibling is doing this. So that's where working with these individual families is so important, because dynamics, which family dynamics is such a huge part of what we do every single day. I don't know how to treat a child without working with the family, because the family, it's all about implementation and understanding, look, listen, and learn, and figuring that out. It is about understanding the child, the family, and their unique needs. And the parenting styles, all of that goes hand in hand with all of this. And I do challenge anyone that can say, my child can be treated without my involvement, my partner or husband or wife's involvement, or the school's environment. I will tell you, it is not an easy process if you're able to do that.
Absolutely. Like I said, we're a whole child approach, and that includes the family dynamics. All that has to be addressed.
Yeah. We don't know how to treat a symptoms, but we know how to treat a family, understand the whys, how that's contributing, understand that it's stages of social communication and respecting those stages and building that connection and comfort. It's all about that understanding and then developing a unique treatment plan. And I say this because it's not a quick answer, and none of this is a quick answer. And so much a part of this podcast process, at least for me as my initial goal, was how can I get out all these years of experience? And having you here, I'm just so grateful because so many things that you share is from your years of experience, Jen. But we will be together again in like a week and a half for Communicant.
Here we go.
Here we go. We love it. It's all day our parent education, and we love meeting the families. And every camp is different because so many questions are different.
And this I love this podcast for that reason.
Yeah.
It is almost like Communicant parent sessions.
It is.
Right? Because you have hundreds of families who come. They all have a different unique presentation of SM for their child. And they're all there to ask questions. And every child is different. Every family is different. And we get to speak about all these different strategies and help that family to say, what is the unique piece for you? It may not apply to the person sitting next to you, but how can we give that person sitting next to you an additional, tidbit that's going to help them to continue to grow? And I love that.
And we say this so often, like whomever our listeners are working with, it really should be a lot of parent education and support and really tweaking the process. It is about that. And it's about educating parents. It's about educating the schools. It's about understanding the child and their unique needs. And that involves siblings.
Yes, siblings are part of the equation.
They are. They're part of the process. And I just am grateful for this podcast. So thank you, Jen, so much for this opportunity.
Thanks for having me.
I love it. See you next week at camp.
If you have questions on anything covered in this podcast episode, we want to answer them. Please head to selectivemutismcenter.org/ask-DRE. And we'll do our very best to answer them in upcoming podcast episodes, Smart Center newsletters, and on social media. Thank you.